So, to get started, we're asked a lot.
We're asked a lot. What is autism? On our screen, it says autism is a complex developmental disability. It's not a mental illness. It's not a behavior disorder. It's not an emotional disturbance. It's a developmental disability, and it usually appears during the first 3 years of life, although lots of times people are diagnosed or found eligible for services in the school later than 3 years. It affects a person's ability to communicate and interact with others.
Yes, and it's really important to understand that if a individual has autism, it typically occurs between, what would you say, 18 months?
Usually identified by about 18 months. We're able to do that now. Unfortunately, a lot of people are diagnosed later,
Right.
or they might not be found eligible till their school age, which is unfortunate because early intervention is key.
But you hear about people being diagnosed when they're 9 or when they're 12 or even after they're an adult out of school. But we just want to make it clear you don't develop autism after
Right.
approximately 36 months of age or 3 years old. You've had it and it just has gone unrecognized. It's defined by a specific set of behaviors. There's no medical test that can be done, amniocentesis or blood tests or enzymes or anything that you would typically think of. It is defined by watching, by observing, by looking for behaviors. It's known as a spectrum disorder, which means you can have just a tiny little bit or you can have a whole lot of it. And it affects the individuals who have it very differently. Kind of like snowflakes. No two are exactly alike. And again, it's varying degrees of condition.
We have a saying in the autism community, if you've seen one person with autism, you've seen one person with autism. It does present differently in different individuals, for sure.